Mark has held numerous senior leadership roles across government bodies and government-funded organizations successfully. He's run his own marketing agency as well, and he has delivered high-profile multi-million-pound campaigns as a chartered marketer. A fellow of the Chartered Institute of Marketing, and he holds a master's in marketing. Mark is also a non-exec director for a leisure company and holds a similar role for a charity. So Mark, we are really delighted to have you this morning. Thank you for supporting this conference, and thank you for everything you do in NHSBT to drive awareness and to drive really the efforts towards eliminating inequalities in donation. We're both blood and organ donation. So thank you and welcome. You're going to be talking to us about the successes and opportunities of the NHSBT Community Grants Program. So welcome.
Thank you very much. I don't know if someone's going to run some slides for me, and I apologize if I keep saying next slides, please, like we were in COVID many years ago.
I will do that, Mark, for you this morning, and it's okay. I will try and read your mind as well. Okay. I don't know if you can, my slides are coming on.
I can see your slides, yes.
I need to just.
And I can see, yeah, you drop down to slide 5, I think it is.
Oh, sorry, I'm just going to try. I might have to unshare because I didn't enable sound. Bear with us. Technology is not always perfect.
Well, while you play with that, let me just do some little intros about me and the team and some thanks. Firstly, thank you to you, Winnie, and the team for organising this conference. It's really interesting and really timely. But also thank you to Orin and the team. Orin and the team work really closely with NHSBT, and some of the messages Orin has just gone through are aligned with some of the messages I'm going to go through with my slide deck. And just to add to what Winnie said, I'm the Director of Donor Experience. For those that don't know me, Mark Chambers. I've been here in NHSBT for just over 3 years. I work with the team to really grow and diversify our donor bases. So that sits across organs, blood, stem cells, platelets and plasma. And there are some big hitters in some of those areas when we look at our organ donation register, which has over 30 million people.
Think we may have lost him a little bit. Thank you so much I can see in the chat box that you've entered where you're joining us from, lots of colleagues from across NHSBT.
I'm back, Winnie.
You're
I don't know what happened there. I got spiked out.
Thank you, Mark.
I'm back. So, do you want me to carry on?
Carry on. I was just acknowledging the many colleagues that have joined us today. Thank you.
Yeah, brilliant. And it's good to see so many people from across the country and colleagues from across NHSBT and the sector. Can we jump forward one, please? Stay saying next slide, please. So, as mentioned, I'm talking about the Community Grants Programme here, which is a programme run out of the Donor Experience team, specifically out of the community engagement function that sits in Donor Experience. I mentioned before around the need to grow and diversify our donor base and my role, but the important part to mention there on the left is to meet clinical demand and reduce health inequalities. The community engagement team set up and runs the Community Grants Programme, and it's really important that we work with regional community engagement teams through our community engagement function, who are focused on hyper-local efforts to engage with communities. CGP and all our partners is a key delivery mechanism, and it's a real strong part of this work. It's really important, something that Orin was saying, it's really important to have a strong message, but it's also really important to have the right messenger. So I don't know, Winnie, can you click on the play on the right there and we can play the video from Primrose, just briefly. Thank you. So let me have a few more words before we skip onto the next slide, which, as I mentioned, for conversations as sensitive and as important as organ and blood donation, the right message matters, but so does the right messenger. And as you see on the right, some of our community engagement work is around building trust, shifting attitudes, and encouraging action. But we cannot build trust on our own. We know there are issues of faith and culture, misconceptions and misinformation, which Oren mentioned, and some mistrust in institutions. Some of these things are long-standing, deep-rooted issues that can't be solved by simply giving somebody a leaflet or a campaign or a single intervention. We need to partner with organisations as part of our wider communications mix, and these organisations need to have the cultural fluency and local credibility to connect with our partners and with communities. We jump forward one, please. And when these voices talk about donation, people listen. People listen because it doesn't feel like an institution telling them what to do. It feels authentic. It feels like a conversation with someone they trust in a space they feel safe, which is so important for such a sensitive subject, especially organ donation. When you combine these ingredients, you get incredible results. Conversations started, people engaged, and ultimately lives potentially saved. Some of the stats on the right really demonstrate the impact. If you look from our work from the original CGP, which was in 23-24, we see that we engaged and reached 11.3 million people, and there were over 400 community-led events. These community-led efforts are vital because they create the conditions for change, opening space for trust, understanding, and dialogue around subjects that can take time to explore. Across government, we talk about behaviour change, but it doesn't happen instantly. But every informed conversation lays important groundwork. By empowering trusted messengers on the ground, this programme creates a confidence and understanding that ultimately saves lives. It's a powerful reminder of what's possible when communities are placed at the heart of our mission, which is the Community Grants Programme. Crucially, this is more than just one-off actions. We are seeing fundamental shifts in attitudes, increasing propensity to give blood from rising from 52% to 61%, an increase in willingness to donate organs after death, going from 59% to 67%, with community engagement being a key driver behind this. Thanks. Can we jump to the next slide, please, Winnie? So what makes these outcomes possible? Our evaluation and conversations with partners point to a set of building blocks that consistently underpin successful projects. Generational differences, engaging young people as change agents, creating relevant culturally rooted materials, community collaboration, face-to-face engagement. Not every project uses every block in the same way, but it shows the patterns behind the work that really drives behaviour change. So if we look at generational differences, we know that older individuals often engage with religious and cultural frameworks where values like compassion and service are key motivators. By winning their trust, organisations are able to activate whole family networks and communities through intergenerational influence, something that was a key focus for Vanik Council's community work. And if you look at face-to-face engagement, which is key to organ donation, in-person events create space for meaningful dialogue, where individuals can voice personal concerns, ask questions, and hear lived experience from recipients and donor families. This human connection resonates deeply, building lasting trust and emotional investment. And what do these building blocks look like in practice? If we jump to the next slide, I can talk through some examples. So here we have a book, and I'll go on to talk about the book from Shade 7. It's important that the challenge that Shade 7 have was how do we make the urgent need for more Black and Asian organ donors feel personal and immediate. Shade 7 took a different approach. Rather than a standard awareness campaign, they created a beautiful children's book focused on those with lived experiences and softly introduced the concept of organ donation, focusing on real-life heroes. And that's at the heart of the CGP programme, empowering communities to share their own authentic stories and create meaningful impact. What happens when you take this authentic community-led approach? It translates into a compelling story into a tangible result. if you look on the right there, you'll see some images. And Shade 7 used the book to engage audiences of all generations in free community activations. In the middle there, schools and educational settings, lesson plans were developed, assemblies and book readings were delivered nationally and sometimes virtually, and led by those with lived experiences. At the top, there were some large events speaking to families at cultural fairs and mellas, including Eid in the Square, as well as Instagram lives with lived experience stories shared. And at the bottom there, corporate events, sharing the book and real life stories with different organisations, including Barclays, with a webinar delivered to over 300 staff internationally. This wasn't just the children's book, it became a powerful tool to spark dialogue across homes, schools, communities and workplaces, connecting generations through shared learning. In fact, it often made it easier to engage adults. The story offered a softer, more accessible way into what can usually be a difficult donation. And the book reached a minimum of 20,000 individuals. This single case encapsulates the journey of CGP in empowering trusted grassroots voices to lead long-term meaningful changes. Shade 7 isn't unique. The impact is replicated across the country and across multiple areas, supporting partners to create impact in ways that are relevant and authentic. Can we jump to the next slide, please? I'm going to go through some of the examples here of some of the work we've done, and I'll finish on something that's quite powerful. So starting with the University of Bedfordshire. The UOB delivered a dynamic student-driven project aiming to normalise conversations around deceased organ donation, empowering students to lead awareness and educational activities in the university and in their local community. They leaned in on some of the key building blocks I highlighted earlier. They focused on community collaboration. They worked with local government, faith leaders, health professionals, cultural grassroots networks. And they worked with a local councillor, Fatima Begum, who was a double kidney recipient. They harnessed faith moments, leading an Islam and organ donation event. They empowered young people with their student change makers, developing a model that can be replicated across other universities across the country. They delivered a number of face-to-face engagements across university and in collaboration with key community organisations. They worked with the media, featuring items on ITV News, University Media and more. What this example shows is that when projects are well designed and supported, impact follows. With continued investment and scale, we can extend these results even further. Just to highlight, this was from our previous funding round as well. So we're in the middle of a second funding round. Can we skip to the next slide, please? So building on the success of last funding round and recognising the value of long-term trusted relationships, the programme has moved to a 2-year funding model. This gives partners the stability to deepen relationships and deliver lasting impact. Organ donation isn't a one-touch conversion, and it's not a one-touch conversation either. Whilst ensuring we're building on the legacy of good work, we're also excited to work with new projects and ideas. For example, there's some images there, and I'll talk for a couple. Hospital Art Studio, co-creating a public mural to celebrate Black and Asian blood and organ donors in the heart of Luton Town Centre. On the right there, we've got a chatbot developed by the University Hospitals Birmingham and Dr. Shafi Malik's team. It's a unique project developing a WhatsApp-hosted chatbot to counter misinformation around organ donation. There's an image there from JOD, so the Jain and Hindu Organ Donation Alliance, working with us across both deceased and living donation, delivering exciting community events with Jain and Hindu communities, raising awareness at key moments such as Diwali in the square, and unique activity engaging kidney patients in the patient pathway to increase education and awareness. And then in the middle there, we've got Amjad Ali. I'll come to that slightly short video on that shortly, but the work that Amjad Ali did and his family did, it gives an example of high quality work delivered by partners and the importance of authentic storytelling. Amjad Ali was a unique leader and kidney recipient within the Muslim community who did an immense amount of work highlighting organ donation in Muslim communities and supporting NHSBT to develop the fatwa on organ donation, working closely with Sophia, Amjad's daughter, who has led this work to develop the docudrama and who's working on the best dissemination plan. Each of these projects highlighted here deliver powerful and unique impact and value. I'm going to show a video next. It could trigger people. So if we skip to the next slide, just a warning that it's quite powerful. Has a slide gone missing? I think I'll mute Winnie as well.
Sorry, Mark, I think we may have something happened and disappeared. Are you able to talk us through it, if it's okay?
I might be able to play it. Let me
Okay, please.
let me have a little play here. Give me a second. Sorry, everybody.
Stop sharing.
Sorry, my laptop's just loading.
No worries. While it's loading, just want to point out to anyone who will be interested in applying for a community grants for the next round, to reach out to find out more. Umar runs the community grants program, and he's in the panel discussion later after this session. So send any questions or requests to have conversations with him. I think that will be appreciated. Personally, I think it's the best initiative NHSBT has launched, the community grants program, utilizing and empowering communities to become solutions for their own challenges, and partnering and valuing those communities as stakeholders in this tackling inequalities and informing people. So it's really amazing. Thanks, Mark.
No worries. Can you see my screen?
We can, yeah.
Give me a second. It's just skipping through. Right. There we go.
Okay.
Sabeh is a word that has been used in my house from the day I was born. Either mum would say it to my dad, mum would say it to me, dad would say, you know, it's a word that we've all said to each other. Sabr simply means to have patience during hard times, and it's a word that's often used in the Quran and in its teachings. When Dad did pass, Mum, I think she probably said it to me every day. Just have Sabr, it'll be okay, just have Sabr. For someone that's been on dialysis, it does dictate your life. It also has that exact same impact on your loved ones as well. My father got diagnosed with kidney failure at the age of 20, 2 weeks after his 20th birthday. He had to be on this machine 3 times a week for 8 weeks. And, you know, his diet was restricted, his fluid intake was restricted.
He would suffer in silence at times. He wouldn't tell anybody anything, but we could see in his face what kind of pain he's going through.
I didn't know what kidney failure meant. And to suddenly see him like this, distraught, was a shock.
To be on dialysis and think I have years and years of this and I can't escape. It must be very, very depressing.
Why are we letting people pass away when we know that if we have members of the community sign up on the organ donor register, we can save people's lives?
Being on a dialysis machine for 4 hours is a bit like asking someone to run up a hill for 4 hours, because it's hard work on the heart. People are dialysing for a day, They have to put up that for a day, and then the day after they feel rough, and just by the evening when they're feeling better, the next day they've got to come back in again.
The only reason why these patients are not getting transplanted is because of shortage of organ donors.
Dialysis is a holding pattern where you're existing. It's not a nice process, but you've got to do it to stay alive.
You know, there are people who are hurting and suffering out there and living this dialysis life, but some people have the ability to change.
Hey, Mr. Grumpy Gills, what you got to do when life gets you down? You got to just keep swimming, and that's what I've done. It may have been a doggy paddle at some stages, and there's definitely been some backstroke, but we got there, and everybody's travelling to their journey at their own pace.
Again.
Thank you. It didn't show the last part of the video, but we can put it in the chat for people to watch later. That was my last slide. I was just going to say the key priorities over the next year are, I suppose, visibility, collaboration and support, ensuring the impact of all these projects is seen, shared and strengthened as we prepare for the next funding round. And there is a highlight report from 23-24 if people would like to see that as well. I'll finish there. Thank you, Winnie. You're on mute, Winnie, as well.
Thank you, Mark. Thank you for reminding me. It was a powerful reminder of why we do what we do, for those people that really need the help the most. So thank you.
No worries.
We'll move on to the next session, which is the panel discussion. So any questions you have from the two speakers earlier on, please put them through to on the chat, and we will try and pick up what we can through the discussion. So I will invite John Starling, my colleague, to come in and facilitate the next session for our panel discussion. So welcome, John. If I can see you, I will be able to highlight you.
Thank you, Winnie. I've highlighted the panel members. Those are the most important people. I'm happy to hang about in the background and facilitate, so that's absolutely fine.
We need you. We need to see you as you talk. Do you want me to share the slide with the bios?
It's okay. I'm happy just to introduce the panel members, if that's okay, Winnie. Thank you very much. Just conscious of time, we aim to sort of this session to run till about 11:40. So we've got about 50 minutes. So a really exciting panel we've got for our session this afternoon or this morning, entitled Valuing Minority Ethnic Involvement in Donations. So first of all, I'd like to introduce Kirit Modi. Kirit is a kidney transplant recipient, had his transplant in 2001. He's also honorary president of the National Kidney Federation and NBTA, National Vein Transplant Alliance. Kirit is a great critical friend here at NHSBT, and we've valued his insights over many years. And I've known Kirit personally for probably five or six of those years, and I always rely on his support and his advice. I'd like to welcome Umar Malik. Umar works alongside Mark Chambers in the Community Grants team. He's the Community Grants Engagement Manager here at NHSBT. And thank you, Umar, for stepping in at relatively short notice to join the panel today, but your presence is much appreciated, so thank you. Next, I'd like to introduce Rohit Sagu. Rohit is a children's nurse and a PhD candidate at the University of Bedfordshire, and he's also the founder of British Sikh Nurses, which he founded in 2016. He's a fantastic leadership across nursing, and his leadership's been recognised by receiving numerous awards, too many to list on the meeting today, and he's been named among the Nursing Times top 75 influential nurses in the UK. And Rohit has been an active advocate for organ donation over many years. I first met Rohit about 5 or 6 years ago, and he's been a great support. And last but not least, I'd like to introduce Turquoise Holmes. Turquoise is one of our stem cell coordinator team leaders here at NHSBT and has worked in the stem cell registry for over 22 years. She is also co-chair of our GRACE network here at NHSBT and took up that role in 2021. And she's also an equalities representative for Unite the Union. She's a passionate advocate for raising awareness about sickle cell, blood disorder, and the need for blood donation from those communities that are affected. So a big welcome to all of you. I'd like to begin by putting a question to each of the panel members in turn, if that's okay. It's to all of you. What does valuing ethnic minority communities and donation look like to you, and how can we do it better? So I guess go to Kirit first for that question. Oh, Kirit, you're on mute, sorry. Oh, I still can't hear you. And while we're trying to sort out your mic, Kirit, Umar, I'll come to you with the same question.
Hopefully my mic's working.
Yeah, we can hear you. That's perfect. Yes, thank you.
I'm a bit worried. Gremlins seem to be in the system this morning. But no, thanks for inviting me onto the panel as well, and for some really good sessions delivered so far as well. So I was thinking this morning about this question and had a quick look at the panel title as well, which is valuing ethnic minority communities' involvement in donation. And for me, I was thinking valuing ethnic minorities in donation isn't just, for me, it's not just about involving them, but more about empowering them to lead in discussions, in activities, in developing initiatives and services around organ donation. Because for me, real change happens when the people most affected by the issue, and that was highlighted by some of the inequalities mentioned, are shaping the solutions and not just participating in them. I guess it's about, empowerment and co-creation, and co-creation means shared ownership, shared power, not simply, seeking approval after decisions are made, because in those communities, there is that lived experience, and lived experience is expertise, cultural faith and insight is expertise. And Primrose, as she mentioned, trusted voices build that trust, which is such an important point to mention when it comes to organ donation and Black and Asian and faith and culture communities, because that insight and credibility that community partners bring, it can't be replaced and it can't be replicated. And it doesn't just apply to raising awareness or getting more people registered on the organ donation register. That expertise is valuable right across the system. It can shape how we design services, how we think about donor and patient pathways, how we speak to communities, even how we work with patients and communities in hospitals. And that's a big piece of work that can help us sustain change in communities. When they lead the conversation, it builds that capacity, builds that momentum far beyond, like Mark mentioned, kind of individual initiatives or campaigns, and can really influence the way we work across the whole piece. So for me, valuing communities' involvement in organ donations means, shifting from outreach to these communities to genuine partnership with these communities when they're leading the work. You get the lasting change, which of course we know takes a little bit of time from an organ donation perspective.
That's great. Thank you very much. Thank you very much. Turquoise, same question.
Okay, morning. Thank you, John, and thank you, Winnie, for inviting me to the panel. And a lot of it has been said already in going forward and how we should be communicating and working with our communities. But we need to show visible commitment to equity, and publicly share our goals for workforce diversity and how to connect to improve patient outcomes in organ donation and transplantation. And for me, it's like representation. And I know it was mentioned before, you know, I always say that even in our blood donor centers and when it comes to our SNODs, representation makes a difference. And I think Primrose also said it in her video that, you know, sending out the message and, you know, you gear to the audience you're talking to. And if you're going out into the Black and Asian community, you know, representation makes a difference. And for me, it's the trust, you know, it's building that trust within your community and the trust from the organization itself for people to come forward. You know, organ donation is one of the hardest things to get people to, you know, sign up for. Blood donation is hard, but it's much more easier. And as Oren said before, there's those myths there that stop people, you know, wanting to connect and wanting to be able to participate. And it's the fear of they go into a hospital and they're not going to come out. And this fear lies really deep within our communities.
Thanks, Turquoise. I think a strong message from yourself and Umar that representation and empowerment are absolutely central and key to valuing. Kirit, welcome back. You're now on a different device, so hopefully we have sound.
I hope you can hear me now.
We can hear you loud and clear. Thank you, Kirit.
That's great.
I guess same question to you. What does valuing ethnic minority communities and donation look like to you?
I think, John, I want to give the example of how NHSBT and NBTA are currently working together. Yeah, because we were established over 10 years ago, and we have worked out a good way of developing partnership working. So we have a formal partnership working arrangement, as you know, with NHSBT, and which is sort of, you know, monitored at the director level and obviously by NBTA. And I think that's beginning to work well. And so the idea I have is, you know, when I'm a patient, I'm a kidney patient, and I believe that as far as the NHS is concerned, the NHS should not make any decision about me without me. So what I'm saying is, whatever decision, whether it's about transplantation or changes in my medication or whatever it is and so on, they should involve me as a patient, yes, in joint decision making based on accurate information. And I think that same principle applies between NHSBT and the ethnic minority community groups. So I think the principle we should be working to is that NHSBT, when they're doing work involving ethnic minority communities, you should do nothing without involving the ethnic minority communities, yes, in that process. And by that, I'm talking about at a strategic level, you know, when you start planning things, involving them at an early stage, yes, rather than at the last stage saying, this is what we're going to do, can you help us? That's not the approach. You involve the community right at the beginning. And I think we are lucky in the UK that we have NBTA. Yes, obviously that's the key body. But then we have lots of individual groups like the ACLT, CHORD. We've got lots of community groups and so on, which are powerful groups which we need to involve. So I think my message in terms of we're at a good place because we've got a formal arrangement now of working together. But I think that can be developed further because my experience is that in some parts of NHSBT, these arrangements work well. In some, they don't. And we need to try and get to a more consistent level of partnership working. And if we did that, then the communities will feel we're being valued because you're seeking our views at the right time, involving us in the key decision-making process, yes, and also taking joint responsibility with you, yes. This issues about organ donation, it's not just the responsibility of NHSBT, it's all our responsibility. And I think to do that, we need to work together.
No, thank you, Kirit. I think that's really important. Rohit, welcome. Same question to yourself.
Yeah. Hi, John. Hi, everyone. And thank you, Winnie, for this platform today as well. I'm going to look at this from a very different angle, from the lens of British Sikh nurses, of what we do in the last 6 years and the established relationships that we've had with NHS organ donation. And I think, yes, as it's been said, representation is key. But I think the most important thing from a faith-based nursing perspective and a faith-based community perspective is actually having community-led conversations. We really need to do that. So I'm kind of against empowerment, because we should not be empowering. What we should be doing is working together. And that's the most important thing that we need. We need to align our messages with the communities, and also acknowledge community groups and experts within there as well, and supporting them sustainably in terms of what they need to do. Looking from the lens of living donation, which we haven't done, because a lot of the families that we've supported 9 families for living donation. And you would have all known Anaya, Hope for Anaya's campaign. That started off with us. We were the catalyst for that, and Anaya found her donor, and recipient and donor are just healthy at the moment. So it's really about listening to families, and they came to us and they were heard, respected, understood, and the trust grew within that relationship. And that selfless service allowed the dignity and compassion and shared humanity in terms of just raising the awareness of organ donation and living donation as well. So we don't tend to talk about that as well. So that's really key. So I think, we need to think about that. It's about partnership, not tokenism. And I think the message, if we have anything, I think the quote I would leave today with everyone, it's about messaging and building relationships. That's the most important bit. Once you've built relationships, you can then relay your message. Thank you.
No, thank you, Rohit. And I think you're absolutely right. Partnership is absolutely key. Another question, I think I'll go to Rohit again first with this one. Sometimes when our specialist nurses are talking to families from some ethnic minority communities, it feels like there's a very different attitude across the generations. And where we have quite a family that are quite receptive to potentially to supporting organ donation, we'll then have conversations with either the religious leaders or community elders, and they come back with a very different decision, and it turns out to be a decline. How can we change the mindset of that influential part of the communities to either change it to a more positive influence or more engagement with organ donation, or to offset if it's still a negative input with the families? So Rohit, I'll come to you first and kind of interested in your perspective.
Yeah, again, it's not about empowerment or telling communities what to do. It's actually listening to respected voices, and confidently and accurately. And I think the one thing that we haven't talked about is lived experience, which actually NHSBT thrive on lived experience, because you've got lots of recipients, donors that you actually just put out into the media. And I think we really need to think about that, because those with lived experience take real ownership of their message, and it becomes positive and it doesn't become obstructive. And that's really key. Though over the 6 years that I've worked with British Sikh nurses and organ donation, yes, there is a massive generational shift. The youngsters, we've got youngsters who are really receptive to it. They'll take that message on board. You put TikTok out and they'll watch it for 20 seconds and they'll get the story. But it's actually it's that shift between those who are probably about my age and above. I'm not saying my age, but my age and above, but it's that kind of thing. And also those who are nearing probably the end of life. That's where that change needs to happen as well. So it's about enabling them and talking about faith and talking about the concept of what they're going to do, and actually acknowledging people's wishes. And I say with this wholeheartedly, at the end of the day, it's really talking certainly for the South Asian community, it's a very taboo subject to turn around and talk about death. We'll talk about marriage, we'll talk about how much we earn, businesses, etc., but we won't talk about death. So it's really about embracing death and for South Asians, without the Bollywood drama, it's about celebrating death as well. And I think we really need to think about those conversations as well, and making sure we acknowledge people's wishes before end of life appears.
Yeah, no, thank you, Robert. And Kivit, same question for you.
Is that for me, John?
Yes, absolutely.
So I think, John, you raised an important issue. We know about the differences in generational attitudes and so on. My experience is that when you talk to donor families, yes, or even living kidney donors, it's very rare that the decision has been made by one individual. It's almost, I'm talking about particularly the Hindu and the Jain community, that the decision is made by the family, yes, so with support of the family, even if it's somebody's leading it and so on. And I think, and that's where our messaging comes in. So faith is clearly a very important dimension of this. So when you say, how do we convince some of the elders, yes, and the elder people or community leaders about organ donation, if the younger people are more supportive and so on. And I think one of the things we've used is really get the faith leaders to publicly endorse and support organ donation. I think that's important. So if I was talking to an older person, they'll always ask me, you know, what does Krishna say about organ donation? And I have to then say, okay, look at the scripture and so on. And we got messages from faith leaders who are respected internationally. Yes, so these are faith leaders for Hindus and Jains in particular. And I think that applies to other religions as well. So I think that is important. The other thing I think is something which I've come to realize more recently, and that's about donor families. Many years after the donation has taken place, you know, taking pride in the fact that their loved ones donated, that they did the amazing thing even right at the end, yes, and so on. And you got so many families like that. And so when people say obviously you miss your loved ones when they're gone and so on, but you can take pride in what they did even at that last stage. And I think we need to emphasize that more. The comfort have done something, you know, amazing, and, you know, and thought about others. And obviously within that context, I think we need obviously more people to share their stories, and that's what we're trying to do. I know we're going to be listening to Shivam Kakkad later on today, and he will share his story about how his family donated his father's organs after he passed away.
Thanks, Kira. 100% agree. I don't think there's anything more powerful than hearing the lived experiences of either a donor family or a recipient. And that's why our ambassador program is so valuable to us. So no, thank you for highlighting that. Yasser, you've got your hand up. Do you want to just come in if you have a very brief question?
Yes, good morning.
Morning.
Thank you for doing this, guys. I just have a point to make. We're talking about culture and the impact on donation. And inevitably that leads to what we're talking about, which is faith. Mm-hmm. But we can't overlook those who don't believe in God and those who don't have faith. And I think we need a different set of messages or a different messaging approach to those people. And I just wanted to make that point as well, alongside what's being discussed.
No, I 100% agree with you. I was privileged enough to attend recently the Healthcare Chaplains Conference, and I had a good long conversation with the chair of a UK Humanist Society, and it was a really interesting discussion around, you know, faith and religion are very different. You know, lots of people have faith, but not everyone ascribes to a particular organised religion. So absolutely, you know, those conversations and involving everybody in those conversations is really important. So I completely agree. I'm coming to Turquoise next, but with a slightly different question, Turquoise. You mentioned earlier about the importance of representation, and we recognise that in order to represent that, we need to have a diverse workforce at NHS, BT, and that also needs to be inclusive if we're going to serve a diverse population that addresses health inequalities. How do we attract more minority ethnic nurses to work for us, and more importantly, when we do, how can we ensure that they stay and thrive in that organisation? Oh, so you're on mute, Turquoise. Apologies.
Always do that.
Yeah.
Okay. Yeah. So for me, it's one of the main things is mentorship and sponsorship. You know, so working again with our communities, you know, seeing what is out there and what is needed, establishing formal mentorship programs with senior leaders and peer networks that support ethnic minority staff in navigating career pathways and workplace cultures. Yeah. Anti-racism and allyship training go beyond, for us to go beyond unconscious bias workshops, because, you know, we always say, yeah, let's do an unconscious bias workshop, but we need something more than that. And we need to equip all staff with tools to challenge microaggression, advocate for equity, and build inclusive teams. We need things that would safe reporting and accountability, because the trust, especially within our organization, is you know, is at a par. So, you know, we need to ensure robust systems for reporting discrimination, with transparent follow-ups and restorative practices. Psychological safety is key to retention. You know, so people who come into this organization need to know that if they come into this workplace, that whatever they do, they can see transparency, they can have that trust in this organization, that if they were to see something and to speak out, it would be acted on. You know, we need to build that trust that when they go into a group, they go into different places, different hospitals, and that they will not get abused. And if they are abused, that something will be done. That's my outlook on it. Thank you.
Thank you, Turquoise, and I think that's really important. And just as a follow-up question from that, I mean, Winnie mentioned earlier in the introduction to the session around kind of wider society and how we're seeing kind of the influence of wider society, an increase in racism, an increase in Islamophobia, an increase in, you know, other things like transphobia, homophobia, etc. What more can NHSBT do to ensure that our employees feel supported in that current wider environment?
As again, I say, so putting on my Unite hat, we got a program that's called Get Me Home Safely. You know, so we need to make sure that our workers, our employees, are safe coming in and going home from work. You know, we need to be sending out messages when we see something happen within society. We send out a message that, you know, that we're caring. We're not two-line words to say, oh, this has happened, we hope you're safe, but we need to show that caring. That's one of our values, is caring for our employees. And if the people who come into work and don't see that, and they don't see a message coming from the top to say, oh, we support you, we'll make sure that you're safe, talk to your managers, you know, we'll make sure that your managers can work with you to make sure, you know, going home, coming in, and especially when it comes to our donor facing centers, you know, people coming in and out, the public coming in and out. How safe are those centers? What are we doing to make sure that our employees and even the donors coming in are safe, you know, coming into those centers? So those are the kind of things that we have to make sure that we work with.
Thank you, Turquoise. Very powerful. Rohit, I guess you know, we'll come to you next as someone that's sort of a representative and a leader in Sikh nurses, and I know you've been involved in a number of our recruitment campaigns for specialist nurses over the years. So, what can we do better to attract a broader ethnic diversity of our nurses, and also importantly, how can we retain and ensure that they thrive with us?
Yeah, so again, it was a privilege to be in your advisory panel for recruitment as well, because I think when we looked at recruitment, we looked at all those nuances in terms of retention and the caliber of recruiting nurses or SNODs that you're attracting as well, and actually just the language. When we actually did the application and the statements and etc., is actually the language in terms of it as well. So I think there's a real need for, in terms of retention, is a real need to looking at beyond recruitment, possibly looking at how your staff from ethnic minority have a sense of belonging and progression. And the progression is actually massive. Right? I'm actually currently doing some research with Northwest London Trust on those from ethnic minority nurses and diverse group nurses that actually are career stagnant and they have less leadership opportunities available to them. So there's a real massive bottleneck of stagnation and less leadership opportunities for those from diverse backgrounds as well. I think the most important thing is people like Winnie, who are visible role models, and it's really key to have visible role models that reflect your community, and really do that. And also, again, I agree with mentorship and sponsorship, but actually ensuring for all staff, regardless of background, that's a safe space to raise your concerns and any fear of repercussions for those concerns as well. And it's really about identity in terms of what we do. And in valuing, I think it's really about valuing the lived experience for those who are going through that as well, not just seen as an expert. So I know SNODs are expert, but actually they have a lot of lived experience as well. And that's what strengthens the NHS and that improves patient outcomes. And that's really key, what we need to think about as well. So I think there's a real culture change to this, and it's almost systemic. And we're seeing that now with the NHS, certainly with the recent RCN report that suggests that, at least, there's a huge percentage of nurses from ethnic minority communities or diverse communities that suffer racism. That needs to be combated. There's lots of stuff that we need to really think about. And I think we can thrive if we create cultures, not a workforce, but actually create a really good culture instead of just a workforce. And I think we can thrive from that massively. Thank you.
Thank you, Rohit. And it's interesting that yourself and Turquoise kind of both highlighted the importance of creating that sense of psychological safety for all staff, so they feel empowered to be themselves and take their whole selves to work and be able to speak up with confidence if they do experience any challenges or problems. Turquoise, I'll just bring you back in briefly again, then I'll bring in Candy. So as a question.
Yeah, just going to say something about representation in decision making. Should be visible from leadership roles and involve shaping policies. So when it comes to, especially around donor engagement and health equity, you need the leadership and the representation. But I'm sorry to say, in our organization, we don't have that representation at the top. We only have a few. And, it's sad to say. And good, you mentioned, Rohit, you mentioned about Winnie, and Winnie is really one of our best advocates when it comes to organ donation, and Mark is there in the director of Umar. We have these few people here that do our, great work, but we need more, and we need more at the top. Thank you.
Thank you. And yourself, Turquoise, is a fantastic role model as well. Don't leave yourself out. Thank you. Okay. Candice, you had your hand up earlier. It's come back down. Did you have a question? Or?
I don't have a question per se. I just have a statement.
Yes.
That one, I just want to tell you about an experience I had. I approached a Black family, and because of the fear and what they've gone through the NHS, this family said to me that they're only saying yes because I asked them and I'm in the organization, so they believe and trust what I do. So I think there is something with representation within organ donation. And also, I know you asked a question about recruitment. How can we recruit ethnic minority nurses into? Yes. But I don't feel the recruitment process is available for us, because the way the questions are asked, someone would be a good SNOD, but the way the questions are asked and how we answer them is not what is wanted from the panel. So I think we need to do some work within that to ask the appropriate questions so that they can answer, because my white colleagues, they have experience in that. But as I said before, where I come from, we don't have experience with interviewing, but someone would be good for the job, but they just wouldn't make the marks because of how the questions are asked. They have to internalize the question, put it probably in their own language, and spill it back out to you, which takes some time. So I think much work needs to be done in how we recruit and interview staff.
Thanks, Candice. I think that's a really important observation, and very happy for Winnie and I to work with you in looking at how we can rephrase the questions to ensure that they are more inclusive or more appropriate. There's aspects to the recruitment process that we don't have influence over at a directorate level, but some aspects we do, and certainly very happy to explore how we can improve that.
Sorry,
Okay.
John, just to add to that question. As you know, with what we've done with NHSBT in terms of recruitment, we actually have held workshops on application process, what to put in your application form, what NHSBT is looking for in terms of the role of the SNOD, and also how you go about evidencing what you're doing. Unfortunately, what we found was and some of the scripts, some of the statements did go back to the panel to discuss as well. But I think what we found was that there was a great amount of expertise. There's a great amount of what you do in terms of nursing, but what it lacked was just a passion for organ donation. So I think what we really need to think about is injecting a real passion into nurses about organ donation. And if that comes through to your application form and your supporting statement, that's actually fantastic as well. So that's really key in terms of it. Last thing I just want to add in terms of what we're talking about in terms of race and equality as well. I'm privileged now to be a member of the Race Equality Engagement Group with the Cabinet Office, working with the formidable Dame Baroness Lawrence. And we're really looking at this angle and a health angle to this in terms of what we're doing over the next year. Over the next 12 months and really focusing on lived experiences of different aspects of health as well. And certainly organ donation is top of our list in terms of what we're doing. So I will take back what you have from this meeting to the Cabinet Office and say, this is what's happening, and this is what the lived experiences are. Thank you.
Thank you.
Rohit, sorry, I beg to differ, because we are seeing the ethnicity background nurses coming through to the interview. But that's where it stops, so more and more nurses are coming through, but then they just can't get through the interview process. So we are putting what is needed to get through to the panel, but it's just stopping there. So I think it's a little bit, I know you're saying that we've done the workshops and stuff, but I think more needs to be done with how you answer the questions to go through and pass that interview. Because our white counterparts, they can do that. And it's because they're used to it.
Thanks, Candice. Now, I appreciate there's always more that we can do and we should be doing. It's 100% agree there. And I know NHSBT have just gone through a process at corporate level to move forward with inclusive recruitment. And I know Winnie's been involved in that, as have I. So as that's implemented, we'll see what else we can do additionally at directorate level to maximise the potential for diversifying our workforce. So moving on now beyond kind of staffing and recruitment, I just want to come to Umar and talk about the Community Grants Programme. Obviously, it's a great initiative, and Mark shared a number of examples of that on his presentation, where we partner with trusted members of the community to engage with wider ethnic minority communities. In your view, is the programme achieving all its objectives? And what areas of growth can we expect to see in the future around community engagement?
Thank you for the question. Yeah, I wanted to start with an example actually, and it leans into the first question that you asked Rohit and Kirit around those kind of generational differences and the difficulty sometimes in overcoming faith leaders or community leaders. Tomorrow I'm attending an event tomorrow evening which has been supported by British Islamic Medical Association, who are one of the Community Grants Programme funded partners. And it's an event with one of the world's most respected Islamic scholars. He's extremely influential, especially amongst South Asian Muslims, and was actually named the most influential Muslim on the planet in 2020. And that's not just like a local kind of list of power kind of successful people. That's a list of global leaders and presidents and prime ministers. But this Islamic scholar, Mufti Taqi Uthmani, was on the top of that list. And as part of that event, which will be attended by over 1,000 scholars, community leaders and medics, there's a strong discussion on organ donation. It's a brilliant opportunity, and to be honest, that opportunity was only possible because of the years of relationship building and credibility within the community that BIMA, the British Islamic Medical Association, established through our work with them. It took a lot of time to get to the space where we're able to be in a setting such as tomorrow, where we can start to have a conversation with those influential leaders who rightly can either block or accelerate that impact. But it's important for us to realize that these long established principles, beliefs, ways of working in communities can't be shifted overnight. And our goal isn't to negate these principles or structures or their input, but to engage respectfully and acknowledge their influence and have that two-way engagement, which can then help us to, I guess, identify the key levers within the community to have that impact. Because trust is so critical, but trust can't be rushed. So 100% the community grants program for me is achieving its objectives, particularly when you look at the scale and quality of the impact that our partners are delivering, which Mark covered. But importantly, to recognize the real objective of this program is long-term. Building trust, changing behavior, shifting perceptions around organ donation, especially organ donation, are things that don't happen overnight. So the program, what it does so well, in my opinion, is it helps us to move in the right direction, gives us the time, gives us the relationships which are so critical, which has been mentioned here, and that insight to build that trust gradually, and most importantly, through the people who have that credibility within their community, because the how we do things is critical here. It's most important that we're doing this in the right way, even if it takes a little bit of patience. The model of working with community, working with trusted grassroots organizations, is what makes this so powerful. It's not a top-down campaign, but it's communities leading the conversations in their own words, on their own terms, and that's how you get that lasting impact. So 100%, I feel it's achieving its own objectives in the short term through the impact that the projects are having. It's giving us opportunities that we would never have been able to kind of have that platform on such as an event tomorrow, as well as organizations and events like Jord and the ACLT who are giving us access and opportunity to deliver such an important message. And that value is not just in supporting marketing and awareness of organ donation, but in ensuring that we're kind of embedding and integrating that value across systems, across our recruitment, across our in-hospital efforts, that to ensure that once we bring people into the funnel isn't leaking, they're supported all the way through, so that trust we build translates into action. And just very quickly, for me, the opportunity in terms of the last part of the question lying ahead, within the grants program and our key focus going forward, which is what Mark mentioned and highlighted, is how we can learn and scale and increase, for me, visibility, impact, and integration. So how we increase our visibility internally, externally, across the sector of the work and of the partners and the work that they're delivering, how we deepen our understanding and evidence the impact and the true value of the work that these community grants program partners are leading. How do we put value on having an opportunity to speak on a platform tomorrow? It's very difficult. And most importantly as well for me is how we integrate this work more deeply internally, how we're making sure we're working much more closer with our partners and ensuring they're working very closely with each other as well.
Thanks, Umar. And I think you make a very important point and set a very important context in that there's often a tendency to expect instant results when we make an investment in a particular project, and it's almost like, you know, how we expect to measure the impact of the community grants program is going to be over years, if not decades, not weeks or months. So I think that's a really important context you placed on that. So thank you, Umar. Kirit, same question for yourselves in terms of how the community grants program is working in your eyes. Do you think it's meeting all its objectives, and how do you see it developing in the future?
I think, John, I've been involved with the community grants program since its creation. In fact, NBTA were commissioned to do the first round of community grants program on living donation, and that's the basis on which everything which is followed. So it's now a well-established program. I think we're in the 6th or 7th year and so on. And I think Umar is right. I think it's achieved a lot, and I think there's lots of evidence for that. But I think we've also got to face reality. The reality now is we have the largest number of people waiting for an organ transplant ever. Yes, all the data tells us it's the largest number. The challenges within the ethnic minority communities remain. If you look at the opt-in and opt-out data, which we publish, as you know, by ethnicity every year, that challenge. So I think it is time now to have a review of grants program. We put in a fair amount of funding, I think around £700,000, but that covers, I think, both blood and organ donation and some stem cell donation. So we need to ask the question, if it's so successful, why are we not increasing the funding for it? Yes, should we be doing that? Yes, so that's a strategic decision. And are we covering all the ethnic minority groups? Yes. And when you look at the data, and Umar and I have had this discussion before, yes, there's some communities which are more engaged and take more advantage of this funding than others. So should we be targeting those communities which are not currently taking advantage of this funding to encourage them and support them and so on? And one of the areas, I think one of the aspects of the community grants program was meant to be innovation. Just to say that things, pilot things and so on. And I think there are lots of examples in the existing programs where exciting stuff is being done, but then have you taken advantage of that by scaling that up, right, across the organization? That's a point I think Umar is making. So at the last partnership board meeting with NHSBT, we've agreed, Umar, I don't know whether you picked this up, is that NBTA and NHSBT will start a review of that process, because I think the next funding round is going to be in the new year to try and see, let's take stock of where we are, looking at the current context. The basic principle is right, the messenger, providing funding and encouragement to community leaders to take leadership roles and so on. All of that is correct, but how can we move to the next stage? And I think that's my view, that we need to move to that next stage, now having the experience of running that for several years.
Thank you, Kirit. Turquoise, just bring you in there.
Yeah, I just want to say that, because so back in 2015, I think it was, we within NHSBT, we ran a program which was called the Donor Ambassador Program, and which got me into the role of going out into the community. And I think in that program was so good. It was so good because we had the freeness to be able to go out there and to any event that was going on in our communities. I used to go north, south, east and west. Any event that was going on, I would attend, you know, to spread the word, to do the recruitment. And I would not just talk about blood, it would be organ and stem cells. So all of those things. But unfortunately, that program ended. But me, I still go out there and I still wear that hat as a donor ambassador. And I think maybe something like that back in-house, as well as we have the community grant, should be brought back in, because in the back in like 2022, 23, we did some really good work. No, I'm lying. Back in 2019, before the pandemic, we were really out there and doing some good work. You know, we had a good group of people that represented the community, and we were getting out there to different communities, and we worked with individuals, especially with some who lost their children from sickle cell and that, and we worked with those people, and we made really good impacts. And I think we should carry on and bring something like that back in.
Thank you. Correct. You mentioned about looking at highlighting communities that maybe haven't previously been engaged in the community grants program. Umar, I think I'm conscious. Correct me if I'm wrong. That the majority of recipients of the community grants program have been in kind of London and Midlands. Is there sort of a view to sort of seeing if that can be broadened out more widely geographically, possibly more to northwest Yorkshire or other parts of England? I don't think, if I remember correctly, that the community grants program applies to the devolved nations, does it?
So
No, it doesn't. I think it's.
Go on, Kieran. Did you want to say something?
You go on, Umar. You go ahead.
So it's a national program. So the program funds work across blood, deceased organ, and living kidney donation. And largely speaking, our projects kind of naturally fall into locations that centre around London, the kind of West and East Midlands, and the kind of West Yorkshire area, with some projects outside of that, key focus in Bristol as well. And sometimes we've had projects outside of those areas, sometimes around Essex or in Wales as well. We do have had some applicants for organ donation projects in Wales, and they range across communities as well. So our blood projects focus on Black, African and Caribbean communities, given the need for RO blood in that area. And our organ donation is open to all ethnicities. And includes working with multiple kind of faiths: Jain, Hindu, Muslim, Sikh, Jewish faiths, Buddhist faiths, Chinese communities, Indian, Pakistan. So there's a huge range of work that we do. But largely speaking, there is a weight towards London, and we do need to see how we kind of address that balance more proactively. There is a good balance this year across north of England. I think there's probably a little bit of a gap in the middle, it seems.
Thank you, Umar. Okay, looking at time, that's now 11:40, so probably a good opportunity now to draw the panel to a close. I find it really insightful, some really interesting and valuable conversations. So thank you hugely to the four panel members for your time today and for your really valuable insights. We're going to go to coffee very soon, returning at 11:50, so just enough time to boil the kettle, hopefully. But before we do, I'd just like to take a moment just to introduce Renata Gomez. Renata is our new Chief Scientific Officer who's just joined NHSBT, and she's also going to be taking a key role in tackling health inequality. So Renata, do you just want to take a few moments just to introduce yourself and to talk a little bit about what your role will be within NHSBT, particularly around health inequalities?
Hello, can you hear me?
Yes, absolutely.
Yeah, great, thank you. Hi, I was looking at the clock saying good morning. Nice to see you all. So like John mentioned, I'm relatively new to NHSBT, so I've been around now for six months and a couple of weeks. So I'm the permanently appointed Chief Scientific Officer. In regards to the role really looks into a lot of training, education, research and development as part of the fact that NHSBT is a science and data-driven institution, as you guys will know, because you are very much a big part of it as well. So in terms of the role of the Chief Scientific Officer, the role itself is accountable for the health inequalities strategy, NHSBT, delivering on that. And of course, one of the areas that's quite important is about proactively for us to understand, predict to prevent in many ways, in particular as well as with the health inequalities. In particular, as we understand that the British community, the British demographics is becoming more and more diversified. And what we understand is that the current growth in the British population is going to be down to births which involved mixed ethnicities, immigrant parents, and so on. So in terms of blood and transplantation, that means that we expect to be seeing a rise of the cases that at this moment in time we consider to be hard to match. And we are doing a lot of data analysis to try to understand that area in terms of predict to prevent, to better prepare, rather than just to be reactive. This all sounds great. However, there is a lot of work to do. So right now, what's happening is that about a year and a half ago, a health and equality strategy was proposed, and fairly recently it got approved at executive level. And now what that means is that we are turning into operations, and that means we are setting up a health and equality steering group. To do all of that, it means that we need extra hands, because it's a very big and busy and important part of anything we do in terms of health inequalities. So at this moment in time, in fact, this week, as soon as I'm back from annual leave, we are going to be interviewing for a health inequalities lead, which is going to be really helping us push and drive forward the steering committee in terms of health inequalities, and understanding what we are doing that is very good, where we need to go next, and what we are expecting to come our way soon. So I hope that this means that in terms of OTDT, we're going to be very closely engaged. We already are in several other areas that my role oversees in research and development. So basically a whistle-stop tour, that's really where we are. I hope that's useful. But yeah, happy to take any questions, any comments, and thank you for the few minutes to say hello. My apologies for it coming a bit at a weird time, but Winnie and I were trying to match up with being on annual leave and so on, and I know this is a very important conference, so thank you so much.
Thank you so much, Renata, for coming on short notice. We're going to go on break, but I just want to make a comment, and I'm giving this as well for you to carry on as you start your journey in NHSBT. My experience is that we are doing lots of